In our community, we do 3 different operations, commonly that being gastric bypass surgery, sleeve gastrectomy, and adjustable gastric banding procedures. The sleeve gastrectomy is an operation where a portion of the stomach is removed, making it more slender, more tube-like shape.
And so you're left with a tube of stomach, which holds about a fourth to a half of, well, about a half of a cup of food. And that is what creates your capacity and allows you to eat less. The fact that they remove the greater part of the stomach has done away with a lot of the hormones that cause hunger. You don't have much of an appetite and you can't eat very much, and that's what helps you lose weight so quickly initially. Things do tend to slow down a little bit as you get further from your surgery date, but right at first, for the first several months, you're losing weight at a fairly rapid rate, and most patients have no hunger, which is really nice. The
amount of weight loss is certainly patient dependent, and we talk about what the average weight loss is. Certainly, anyone who loses 50% of their excess weight, that is the amount of weight that they carry over their ideal weight, if they lose 50% or more, they are considered to be successful by national standards. Most people would not be satisfied with just that amount. With the sleeve gastrectomy, there is a modestly increased amount of weight loss on average. The risk of the surgery itself is the same as the risk for any intestinal operation being done on a morbidly obese patient. So I put it in the same category as a gallbladder operation or a woman with a hysterectomy or a colon operation. It's not an inconsequential risk, but it's certainly an acceptable one with the chances for a decreasing risk downstream being much less. And balancing the risk of operation now versus the risk of doing nothing and carrying your diseases forward is what a patient must do. All surgeries have risks, and I knew that as a nurse. I knew what the risks were with this procedure, one of which is possible leak, and I was willing to take that chance. I was certainly putting myself at risk if I didn't do anything, and possibly greater risk on different levels. So to me, the risk of surgery with the sleeve was much lower than the risk of not doing anything.